Well, good afternoon and welcome to the Flint Community Webinar on Coronavirus. And believe it or not, March 4th, this is our 103rd session of the Flint Community Webinar. And we're so excited that you joined us today. As we've shared with you so many times, the Flint Community Webinar is brought to you by the Healthy Flint Research Coordinating Center, which is a community academic partnership that is designed to help to bring a global context to this global pandemic. This is the webinar's intent. We're also supported by the Flint Center for Health Equity Solutions and the Michigan Prevention Research Center. It is my pleasure to be your moderator today. Yvonne Lewis is one of the co-directors of the Healthy Flint Research Coordinating Center. We could not have been here this 103 weeks without the wonderful contribution of so many community partners. We want to, again, as we do every week, thank all of our partners for joining us over this 103 weeks, and especially those who join us every week to answer questions for those of you who join the webinar. Let me remind you, as you're listening today, whether you're listening on Facebook or you're actually in the webinar, please put your questions in the Q&A. We have a number of community partners that are waiting. They may not be speaking today, but the panelists are here to answer any questions that you might have. We've had representation from Hamilton Community Network, the Genesee Health Systems, Genesee Health Plan, Valley Area Agency on Aging, and of course the Genesee County Health Department, Michigan State University, University of Michigan Flint, and the list goes on. We thank you today for joining us. Please, again, let me remind you, for those who are listening, if you have questions, put your questions in the Q&A and we will be happy to answer them for you. I want to acknowledge the fact that said 103 next week will be week 104. This will actually commemorate 2 years. We have been dealing with the pandemic for now 2 years, and we want to honor the commitment that has been made by our community members and those of you who have participated in the webinar. So we want you to join us for a very special edition next week. Every week, for the last few weeks, we tried to address some specific topics that were brought to us by many of you in community. Today, we're going to talk about COVID recommendations. I know you've heard that the recommendations, we talked about it last week, they were going to be changing. We're going to have a report from the Flint Registry. We know that was stood up after the Flint water crisis. And there's questions about long COVID and long haulers. So today, we want to jump right into our webinar and ask our panelists to join me today. I'm asking Dr. Deborah Holden, of course, who is here, Dr. Hacker from the Health Department, Dr. Reynolds. The conversation today, we heard the recommendations that came out. And of course, they've adjusted a little bit what we've been talking about for these last few weeks. So I wanted to ask our panelists today, if you could help us to understand how to make sense of these recommendations in light of the fact that we're still in the pandemic. I'd like to start with you, Dr. Hacker, because they've been relaxed a little, or actually the metrics changed a little bit. We have a slide that talks about what they're saying we're looking at now that we can bring up. But Dr. Hacker, give us the perspective from your role as the Genesee County Health Officer.
So the very good news is our numbers are coming down dramatically. So even under the old way of looking at it, we still would have been below the high level. So that's wonderful news. But basically what they're trying to say is we've had plenty of opportunity now to get vaccinated in the communities. And, hopefully that people who are contemplating it have had a chance to get their questions answered. And as we have more and more evidence of longer use of these vaccines, we see how safe they really are and how protective they are. And so that is one piece of great news, is if you're fully vaccinated and boosted, it is very protective for any kind of serious illness from the current variants we see in our community. And the other piece of it is that we know what works. And so now that they have come out with the availability and also the KN95, using it for more protection for those who choose not to get vaccinated, there are still those ways of protecting yourself and others in your home or in your circle of friends. And so those are the kind of things we have. We also have the new antivirals. I have some concern about distribution of those still, and also the drug-to-drug interaction. So I can talk more about it later, but I would urge that people should not necessarily rely on just that being available, because there are some concerns about what medications you're already on, if you can take those. But we have other ways of coping with it, and we do have a more mild variant in our communities right now.
So as we transition, I want to bring up a slide that we saw yesterday as it relates to the recommendations. The metrics has changed. We were looking at case numbers, case counts before, and now the community level indicators are more from the hospital's perspective. Can you talk about that a little bit? What's the shift in how we're looking at the cases?
So the shift is kind of nice. It reflects, it makes it easier to reflect how concerned we are with the circulating variant, so that if we were to have a different variant of concern that would be cause more illness in people, then we would see higher numbers, even with low numbers of cases. And that's something that has been a concern of mine for a while, is that we weren't really taking into account this balancing act and also preparing if we do get a new variant. And so now they're looking at the hospitalizations, and those reflect as a combination number of people who've been vaccinated in the community, because your numbers would be lower for hospitalizations. The healthcare staffing concerns. We don't want people going to the hospital in need of, whether it's a COVID related or not COVID related. We don't want people having to wait hours and hours, and we don't want to burn out our hospital staff. And we have burned people out.
So thank you. Now, Dr. Reynolds, I know there's some other elements in this whole conversation around the new recommendations. And I was in a conversation with you, I believe on yesterday, and you said you thought maybe they should be inverted a little bit and have more of the concerns about what community impacts are. So can you talk to us a little bit about this? We'll go back to the gallery view.
Most definitely. And trying to keep up with edits over the last 24 hours is a workout, but we are making progress, but we are still in a pandemic, and we don't know when the next wave will come. So there are tools that we must keep in mind. And as I've always said, and Dr. Hackert has always said, vaccination is the foundation for prevention of complications to infection from COVID and many other childhood diseases. But if we search through the document, you will see a statement, here are general guidelines regardless of level. And remember, I said we should act our age and not our shoe size. And Mom said, if you saw your friends jump off the bridge, does that mean you jump off the bridge too? So you really have to pay attention to your specific circumstances, your health conditions, those in your household, and those around the people you have contact with. And so stay up to date on your vaccines. Maintain indoor ventilation when possible. Follow the CDC guidelines for isolation and quarantine, including testing, because the pandemic is not over. And then there's the job of state and local authorities. And thank goodness we have the health department that we have, that even under these trying circumstances are working on vaccination, ensuring access to testing. And I want to go over that testing issue, because Tuesday afternoon I said, I haven't done my testing in 2 weeks. So I went to Word of Life, and there was nobody there in line. I could just walk in, get tested, and get out. And I got my results in an hour. So yes, there's home testing, but yes, there are also these testing sites that are most important. And we have done tremendous work on maintaining equity in vaccination, testing, treatment, and community outreach and support services. But we also have to remember our family members who are immunocompromised or at risk for serious illness. And those include people who have had organ transplants, cancer treatments, or who have a compromising long-term chronic illness. And so they need to have access for rapid testing. Home testing may be a start, but verification at a testing site or with their physician would be next. And they should know where their provider would direct them for possible treatments. And Dr. Hacker touched on that. So then we have to look at the bigger picture issue. Everybody talks about let's get back to normal. You may have heard me say normal was never good enough. We had significant health disparities, infant mortality, maternal mortality, and actually some of those things have worsened during the course of the pandemic. So in a vulnerable community, particularly low resource communities or communities of color, we really have to consider what additional layers we will maintain that may not be seen in other communities that have more resources or who can work at home all the time. So we have to be cognizant of these things before we make our decision, because the choices we make affect our household, affect our neighborhood, affect our schools, and affect our community. So those are the important things. And so they talk about some community settings, such as schools, and some high-risk congregate settings, such as correctional facilities and homeless shelters, might include additional layers of protection that we've talked about over these 104 broadcasts. So we have to maintain a level of vigilance for our circumstances. And I've always said, if you walk into a situation where people are unmasked, it's crowded, ventilation is poor, and you don't know the vaccination of folks, you may want to walk out, okay?
So one of the things you talked about, Dr. Reynolds, is these are general guidelines, but you're bringing us down. The general guidelines are there, but we need to pay attention to what's going on in our local setting. I think that's something that we need to continue to think about as we move into what now is being considered the endemic phase. And I really want to thank you for
I
that,
would
Dr.
pause on that.
Right. So that's why I want to bring Dr. Deborah in at this point, because in a conversation I heard on national news, this is what they were saying. We're moving into endemic phase. And of course, because we want to have a local context here, I'd like our local expert, Dr. Deborah, to give us some more insights on this. How should we really be thinking about this as it relates to what's going on here in Flint, Genesee County? Dr. Deborah.
Great. So, when we talk about endemic, how I want people to think about it is it's now just with us, right? So it's with us. It's here to stay for some undetermined amount of time. It's now with us. What I don't want people to do is throw their hands up in the air and accept the outcomes that we've had to date. That's not appropriate. I always use the example of seatbelts. There was a time when so many people died from motor vehicle crashes. And we said, that's not acceptable. We can do better with public health and prevention. And so we got legislation requiring that all people wear seatbelts. When that legislation came out, do you know car manufacturers were manufacturing cars that didn't even have seatbelts in them? Some of them, or they only had belts in the front, not in the back, and all of that. And that legislation and enforcement of that has probably saved more lives than many other public health interventions. The death toll from COVID, to me, is not acceptable. Why? Because we can prevent people from getting severely ill, and we can greatly reduce the risk. So a part of my concern about how some of our leaders have approached this notion of endemicity is they're sort of saying, hey, some people are going to get sick, some people are going to get hospitalized, some people are going to die. But I don't think we've brought our best public health foot forward yet to really understand how much of this disease should we expect in our population? How much disability and death should we expect from this? To me, we're just at the beginning of doing that work. So when I say endemic, I mean it's now with us, but we have a lot more work to do to really do the best to decrease the burden of this virus on our population.
Thank you. And there's one other thing that we wanted to address. And again, these things are emerging, but we talk about long haulers and long haul. We're still trying to get that figured out. I don't know if there's been enough time for us to truly study it. But one of the things, and Dr. Reynolds, to your point, when you say the vaccine is the foundation, if people get comfortable, and Dr. Deb, I'll start with you and then I'll work backwards. If people get comfortable saying it's okay, we're still going to have people who are impacted with the impact of COVID over time. So we need to think about doing the right thing now so that we don't have these long-term issues. How do you respond there, doctor?
Yeah, 100%. Long COVID is very real for people. And, we all now know people, many of us have had COVID, some of us multiple times. And many of us know people who are dealing with symptoms of long COVID. And it still remains a bit of a mystery. There are people who were relatively asymptomatic or low symptoms or symptoms that they didn't even recognize as COVID. And then several weeks after their infection resolved, started to develop these other long-term symptoms. I know plenty of people who were runners and in great physical shape who really struggled with COVID and are still struggling with some of the long-term effects. Again, it's why this idea of prevention is so important. And I realized that people had this idea, maybe initially, that the vaccine was going to prevent them from catching COVID at all. And we now understand that that's not entirely the case. It does offer some protection from infection, but what it really is good at is preventing severe illness. You got to think the receptors that the virus binds to are in every major system in your body. You don't know how your body will respond to COVID, both during your active infection and what sequelae or long-term symptoms that you might have. So that's something that I'm hoping we'll see a lot more research on, and will also activate some of these other layers of protection that we're seeing peeled back when we get back into a space where rates are starting to go up. This will probably start to look seasonal, and we'll see ebbs and flows. Surges are predictable. And when those things happen, that's when you got to activate what Dr. Reynolds calls your best layer of protection, which is in between your two ears. Yeah. And then all of those other things that we know to do.
Right. So
that starts with the vaccine.
It starts as a foundation. So it's one of those things, looking at what potential risks are there to help us make decisions. And if everybody doesn't get the vaccine, those are other layer protections that we really need to consider, what you're raising. Dr. Hacker, you wanted to make a point too about this issue of the long haul and the risk.
Yeah, so a couple things. I would, sometimes medicine defines things a little different than epidemiology, even though they really walk hand in hand on so many things. But I think while we're still in the phases where we're seeing these large, like new variants that spread worldwide, and remember, like this first Omicron case was just identified in the middle of November, and now we're almost over it. So I would just argue that we can't really call it endemic yet, but we're working towards it, but from the past history, we've seen viruses take usually like 15 years or longer to really become truly endemic and let those waves kind of things settle down. So that's one thing. And then the other thing is the most concerning thing for risk of illness and death is still age. And we're seeing younger ages, if you're unvaccinated, die like 30s and 40s, but still the elderly, the very elderly, really, we need to protect them because they do have the breakthrough in all of our situations. But if they do get sick, they have a higher risk of death.
Thank you, Dr. Hacker, for raising that, because one of the participants in our Q&A is making a point about caring for others. And it's quite a lengthy comment here, but I appreciate it, is that we're still living in we will not stop living in crisis, because, again, many people are suffering the impact of the death and the illness of individuals who've already had it, and then those compromised groups that we talked about. Dr. Reynolds, I want to give you the last comment in our roundtable segment today.
Well, we talk about long haul syndrome. I don't need to say anything more about that, but we have over 200,000 children who have lost their primary caregiver. They are orphans. So one of the long-term consequences are the mental health issues that follow, because some of us don't see the need for vaccination or won't take our children to get vaccinated when they're eligible. And remember, we have senators in the US Senate who have had long haul complications from polio. Okay, I've had a colleague who had long-term complications. It's called Post-Polio Syndrome. You can look at shingles. That is a long-term complication of chickenpox. And now we have the vaccination for this so that we can reduce the risk of these things happening. So this is virus behavior, virus complications. So we have to protect ourselves. And once again, as a pediatrician, as a primary care doc, vaccination is the foundation for prevention of complications from infection.
Regardless of what the infection is.
There you go.
Thank you, Dr. Reynolds. Thank you, Dr. Hackert. Thank you, Dr. Verholden. I know we've only got the tidbits of this today, so we encourage those of you that are listening, whether it's YouTube, Facebook, or in the webinar, continue to come and listen to these experts as they share with us. And I know our team will respond to the questions in the queue, so continue to put those questions in the queue. When we just shifted, we're just shifting from a long-term situation. We're talking about long-haul COVID. But we've also been impacted by the Flint water crisis in our community. And so we could call it long haul water crisis. And we have a registry set up in our community that is designed to help us with some of those issues. Nicole Jones, who is the assistant professor at Michigan State University Division of Public Health, is the director of the Flint Registry. And we're happy to have you today, Nicole, to come and give us an update. We know that there's a report that's been done, and we look forward to hearing from you today, the history, the background, and where we are with respect to the Flint Registry today. Nicole Jones, welcome.
Thanks, Yvonne. So yeah, I hope to share just an update about what the Flint Registry is about and what we've been up to and what our future plans are. And so really want to say thank you to you, Yvonne, for having us on today to give this update. And also thank you to HFRCC for all of your work over the past 2 years to host these webinars. So the Flint Registry is a project that's designed to support individuals who are impacted by the Flint water crisis, and doing that by getting them connected to services and resources. We're a public health registry, which means that our goal is to support the public health of the community. We do that in a couple ways. One is by getting people connected to services and resources, but we also ask people to complete a survey that helps us understand the impacts of the water crisis on their health, so we continue to understand what the ongoing needs are to make our community healthier. You can go to the next slide, please. So our goals are, first of all, to make sure we do a lot of work to connect with people who are potentially exposed, to make sure that they're hearing about the Flint Registry and can participate if they're interested. We do this primarily in 3 ways: through marketing. We have a marketing campaign. We have a social media site if you're interested in following us on social media. We also have an outreach team, which is coordinated by our partners at Greater Flint Health Coalition. So outreach out in the community on a regular basis. And then finally, we've done mailings. So we've done citywide mailings just to, again, share information about the Flint Registry. Our second goal is to make sure that we're connecting people to resources. And our primary way of doing that is to ask people to complete a survey so we understand what services they might be eligible for and what services they're already participating in, to continue to reduce ongoing exposure to lead by making sure that we're connecting people to services that eliminate lead in their environment, to ask about health and child development so we understand what the concerns are, and to share what we learn with others, especially our enrollees and our community, our Flint community. You can go to the next. You can participate in the Flint Registry if you lived, worked, went to school, or went to daycare at an address serviced by the Flint water system during the time of the water switch. So that's April 25th, 2014 to October 15th, 2015, including individuals who may have been prenatally exposed. So you can go to the next slide. The easiest way to enroll in the registry may be just to give us a call at 833-GO-FLINT. Our staff are actually in a training this afternoon, but they are generally available Monday through Thursdays till about 7 p.m., Fridays till 5, and we have staff in the office on Saturdays as well. So that's one way that you can sign up if you're interested. You can also go to our website, flintregistry.org, and there's a Get Started Here button that you can click on to get enrolled as well. Once you complete that survey, we do send you a $50 thank you check in the mail. So I just want to acknowledge the funding that we've received to date and talk about any plans for future funding. This work has primarily been funded by a grant provided by the Centers for Disease Control and Prevention, but we have received additional funding from Genesee County Health Department through their Healthy Start project, which was a grant expansion of their Healthy Start project, and a grant they received from the U.S. Department of Health and Human Services. We've also received funding from the State of Michigan Department of Education, as well as the Michigan Department of Health and Human Services. So the initial funding from the CDC, which is really the primary source of funding for establishing the registry, was included in the WIN Act that passed Congress in December of 2016. Those funds went to the CDC. The CDC then made a grant available, and Michigan State University applied for that grant and used those funds to establish the Flint Registry. Our first sort of wave of funding is ending officially in July of 2022, so it'll be ending this summer. But we do intend to apply for additional funding to continue the work of the Flint Registry. And the CDC has indicated that they are now going to include the Flint Registry as part of their core funding. So the programming that they're offering as part of their Lead and Health division at the CDC. So they've already announced that they will be supporting the Flint Registry as part of one of their core programs, and will be applying for a grant to continue the work for 5 more years. You may have also seen in the news recently that Congressman Killey sort of sponsored a bill to support the work of the Flint Registry for an additional 10 years. Not only did he sponsor that bill, but he had support from all of the Michigan delegation in a bipartisan way to support the continue the work. But at this time, we don't know whether that bill will actually pass. So just kind of summarizing, we are funded through July. We'll be applying for additional funding to continue the work for up to 5 years. But we really see this as long-term work to continue to support people by getting them connected to services and resources, and to continue to look at the long-term impact of the Flint water crisis. So we did recently release a report, as Yvonne said, to just kind of share some of the work that we've done over the first 4 years. So work through last summer. And we call it our inaugural report because it will now become an annual report. But this is our first report, so we're calling it our inaugural report. We shared it out through email and text messages to all of our participants and also to our community members. And if you want to take a look at the report and learn more, it's available on our website, flintregistry.org. It tells you a little bit more about the process of building the registry, introduces you to some of our team members. So we have a team of individuals who are part of the group that conduct the interviews over the phone, help people complete their surveys. We have another team working on referrals. We also have a data team as well. In the report, you'll also get a summary of some of the health and child development concerns that have been reported to us, and then an update on our referrals. So I'm going to turn it over, if you go to the next slide, to Kenyatta, and if you can actually click one more time on that slide, or through all the points, sorry. I'm going to have Kenyatta talk a little bit more about her role with the registry and our goal to include community voice.
Hi, everybody. Thank you. Thanks, Nicole. So the community voice for the registry is really important because during the water crisis, the community voice was suppressed quite a bit. Although community shared to our elected officials, our leaders, local and state leaders, that the water smelled, the water tastes bad, the water smelled bad, the water looked funny. The voice of the people was not heard. And so it's really important to the registry to uplift the community voice, to make sure that the community voice is integrated into every step that we make. Dr. Mona listens to the voice of the people, listens to the voice of the parents, listens to the voice of the youth. We have a youth board, we have a parent partners board, committee group, and we also have a community advisory board. There's so many different levels and so many different ways that the community voice is integrated into the work that the registry does. And even for the community partners, in terms of the funded partners that we have, we want to make sure that we're not working harder, but we're working smarter. So we just tap right into the great work that our partners are already doing, and we figure out how do we, rather than starting from ground zero, how do we start from a middle ground rather than starting all over? And then if something don't exist, how do we fill those gaps together? By collaborating, by working together as partners. And so the community voice is so very important as it relates to the Flint Registry. And these are just some of the ways that we're able to do this through Parent Partners Group, through the Flint Youth Justice League, through the Community Advisory Board, through focus groups and community conversations, through every area, if as much as we possibly can throughout the Flint community. The Parent Partners Group, the Flint Youth Justice League, we try to capture every zip code within the city. We try to make sure that every young person within every school, whether it's a Flint community school or a charter school or some other school, that they're a part of the Flint Youth Justice League. And then as it relates to feedback and surveys and things like that, even when people call in to the interviewer team, we're constantly asking, is there anything else you want to share about how you've been impacted, so that we can carry forward the voice of the people as we're interacting and having conversations and meetings within the office, or as Dr. Mona is going out into the community, whether it's locally or throughout the state or somewhere else, she can share and carry forth the voice of the people. And then we have registry and ambassador trainings. They're only 1 hour. And the reason for these is we want to make sure that people are well informed. We want to make sure that those who are speaking on behalf of the registry, that they understand what the registry is all about and how to advocate and engage people on not only getting enrolled, but getting connected, knowing how to access resources and services as needed for themselves and their family, but just understanding more about what the registry is about and becoming an ambassador. So those are just a few things that we want to share about the importance of the community voice and how it's integrated into the Flint Registry. Can we go to the next slide, please? This page here, I think, is really important. Instead of listing a lot of different names of community partners, we wanted to show the logos of the partners that play an integral role in this partnership and this collaborative effort. And these are just a few of the partners that are so instrumental in all of the things that we do in terms of the registry. And these are just their logos to just give you a visual effect of how we're working together to support the families who are calling in for referrals, for help, whether it's for food, whether it's for housing, whether it's for Live Safe Home program, whatever the situation might be. Sometimes it's just because they just need to talk, and that might be GHS, it might be Hamilton, it might be someone else. But this just shows the extent of partnerships that we began to form through the Flint Registry. And there's so many more that we have not yet added to this list, but this is just some of the referrals that we are making as we're getting people connected to community partners throughout the Flint area. We can go to the next slide, and Nicole, I'll turn it back over to you.
Yeah, I just want to mention that all the partners on the previous slide have agreed to receive referrals from the registry, which means we make a referral to those partners and then they actually reach out and follow up with participants to get them enrolled in their programs. So many thanks to all those partners for taking our referrals. We focus on 4 key areas with regards to the referrals that we make. We ask people, again, in the survey about their potential eligibility for these services. We focus on lead elimination in our homes, health that includes physical health, mental health, and adult or dental health, child development, and nutrition. Along with health, we do have some special programs that are really more targeted to seniors, working with GHP on their to make referrals to their senior dental services. Also, VAAA serves as a hub for us with a number of programs that connect people to. And we also work with G-Card on their senior commodities program to make referrals as well. So we can go to the next slide. Just a brief snapshot of the enrollees. So at the end of our first 4 years, we'd enrolled over 16,000 individuals. We're now at over 18,000 individuals that have participated in the registry. About a third of participants are children. That means adults are completing surveys about their children. Just over 2/3 are adults. Our youngest participant in the survey was 2 years old at enrollment, and our oldest participant was 104 years old when they enrolled. Looking at where people are living when they enroll in the survey, about 83% of individuals are in Flint when they enroll. 11% live in Genesee County, but not in Flint. 4% live in Michigan, but not in Genesee County, and 2% of individuals no longer live in the state of Michigan, but still heard about the registry and decided to enroll just to share their story. As far as how people are enrolling, 74% enrolled online, but there's a significant amount of people who prefer to have the surveys read out loud to them over the phone. And again, I just want to really call out our amazing staff that are on the phone, working with folks every day to help them to complete their surveys. They've all gone through trauma-informed training, so they really are a great listening voice as well. The next slide, please. So I just want to share a snapshot of the referrals that we've made to date, looking at what are the top 5 places that we're making referrals for adults and for kids. For adults, we made a lot of referrals to the PIPE replacement program. People had a lot of questions, and the city of Flint did a fantastic job in really following up with folks, making sure those questions got answered and making sure if they needed to, that they got opted into the program. The second most common referral that we've made to date is to Genesee Health System's Access Center for Mental Health Services. So based on how people are completing their survey, they're either asking for a referral or they're answering a question that indicates to us that maybe it would be best to make a referral to mental health services. The next 3 categories of referrals for adults are all related to food assistance. As a matter of fact, we had so many requests for food assistance, we had to bring on additional providers to provide referral to support those referrals. That's not just, so there's one chunk that's kind of here on the screen that's related to emergency food assistance, and then 2 other programs that are related to longer term support for food assistance. With regards to the top 5 referrals for kids, our #1 referral is the Neurodevelopmental Center of Excellence, or NCE, over at Genesee Health System. It's a place where families can take their children for a complete neuropsychological evaluation and get information about maybe educational resources or medical support that they might need in follow-up. We will make a referral to NCE either if a parent has requested because they have concerns, or if when a parent is completing their survey about their child, there's a number of questions that kind of ask about behavioral health and mental health. So if they score kind of high in the instrument, we call it a screener, it's not a diagnosis, we would then recommend to them that they follow up with the NCE for further testing. So lots of kids are doing really well and parents don't have concerns, and we didn't make a referral to NCE, but a lot of kids either scored high or their parent had a concern. So we did make a referral to the NCE. The second most common program that we refer to is the Lead Safe Home program that Kenyatta talked about, which is really focused on getting lead out of your environment. And then we also learned out the top 5 programs. The top 3 needs that we're kind of identifying is support for families and getting kids enrolled in Medicaid, support for families either because they had a child with an elevated blood lead level or they're looking for a medical home for their child, and then child dental services as well. I think that I'm going to go to the next slide. Yep. So 2 other places to kind of share as useful resources if you're interested in more data. Of course, you can look at our report and see what we're reporting out on. We also have a report called Flint Lead Free that's available on our website if you're interested more about all of the activities related to lead elimination that are going on in Flint and how things are going. I also like to reference the State of Flint Kids, which is another website that has a lot of great data, dashboards that you can look at sort of trends of how Flint kids are doing overall. And then the next slide. If you have any questions, again, you can call us at 833-GO-FLINT. Our email address is right here. You feel free to follow us on social media. Again, our long-term plan is to continue this work and continue to get, making sure that we're getting people connected to services and resources, that we're understanding what the needs are, and continue to apply for funding to continue this work. Thanks, Yvonne.
Thank you so much, Nicole and Kenyatta. I just want to ask you a couple of quick questions because we have had some inquiries. And I do see you had Valley Area Agency on because we know when the registry first started, there was a lot of focus on children and infants, but you're not limited to children and infants. So you are making referrals for seniors as well?
Yeah, so of course, seniors will qualify for any of the adult services, but specifically for seniors, Valley Area Agency is one of our kind of hub partners, and they specifically provide resources for senior crisis intervention, things like Meals on Wheels, short-term health care for those who qualify. We also refer to G-Card Senior Commodities Program. It's specifically to support seniors with food assistance, and then Genesee Health Plans senior dental program as well. So we have a few
So
specific.
it's more than just what initially was thought about the registry being for kids only, and I kids only. It is for the general community, anyone who was affected by the water crisis during that water switch. And so thank you for that. I also noticed the NCE, and I've asked Katie Baxter and Elizabeth Birch, because that you refer to them, but we had questions about the NCE. Have just a couple minutes. Could you just give us some insights and give out that number if families are interested in getting their child connected to NCE?
Sure. Thanks, Yvonne. Sorry. Yeah. So if your child is interested in getting neuropsych testing as a result of being exposed to the Flint water crisis, we'd want you to call 810-257-3777. And what will happen is that you will get assigned, you will have someone who will help you get through that process to get that testing.
Thank you. So just because we do want to, and Kenyatta, you mentioned it, we're working in partnership. No one organization can do this alone. And there are resources that are allocated for each of the groups to do the work. So for those of you that are listening and you need that referral, let's give that number for the NCE one more time, Elizabeth, please.
Sure. It's 810-257-3777.
Okay, so please call that number if you want more information about the NCE. And again, if you want to get connected to the Flint Registry, there's still time. I understand you're going to have hopefully 5 more years, because just like the water, we're talking about the long haul of COVID. Many of us feel long haul trauma from the water crisis. So let's continue to utilize these resources. Thank you, Nicole, Kenyatta, and appreciate you stepping into Elizabeth with respect to the Flint Registry. Dr. Deborah Verholden is going to give us an update today on our numbers and a little bit of the health equity conversation.
Okay, great. I don't know if my partner, Mary Catherine Crawford, is going to join me, but things are looking good. In Flint, we just had weeks of decline, slight little blip. That's, I'm gonna tell you from a stats perspective, an increase in 1 case. Basically things have stayed relatively low, both in Flint and in Genesee County. In the prior week, in the weeks that we report from February 21st through 27th, we went from 222 to 175 cases in Genesee County and from 31 to 32 cases in Flint. So this is good news. Things are going in the right direction. Cases are stably low. So yeah, cautiously optimistic right now.
Thank you. Was Mary Catherine going to share, or?
I don't know. I guess not.
I
Okay.
guess sorry, I just want to echo that idea of being cautiously optimistic. And I also just want to kind of use this time to say I'm really happy that we had the conversation about the language between pandemic and endemic, as that was something I just found to be super helpful and important that we talked about this week. But yeah, super excited to see these trends going down along with our positivity rate, which is getting closer and closer to that 5%, Yvonne, that we talked about a couple weeks ago. We went down about another 3% in the last week.
All right, thank you. And thank you, Dr. Deborah, and thank you, Mary Catherine. One of the ways that we're also looking at how we're impacted in our city is to have an update from the city. And I know the city is doing a number of things, both the water crisis and COVID. Kiana, tell us what's going on.
Yes, hello, good afternoon, everybody. Just a few updates here from the city of Flint, beginning with the reminder. The last listening session with Mayor Neely and Ernst & Young for the ARPA dollar discussions will happen on March 8th. That's at IINN, just past downtown. The address is listed there, 4800 Saginaw Street. Those sessions start at 6 p.m. and go until 7:30. So the community is invited to attend. You do not have to reside in that ward in order to attend the meeting. All of the community is welcome and there is an opportunity for everyone to add their input. In addition, if you cannot make the meeting, you might access the sessions on the city socials at facebook.com/City of Flint. They are broadcasted live there. You can also email at input@cityofflint.com. So if you have something to say, any input at all about how we might spend the American Rescue Plan Act dollars, you are invited to share that input with the City of Flint. In addition, just a couple of other updates from the city. We are still holding the vaccination clinics at the mini stations. So happy to hear that the numbers are trending down, but we do still want to have the resource available. And so on Monday, Wednesday, and Friday, we are continuing to hold those sessions. And the one on Wednesday at the North End mini station, I did want to just make note again that we do offer testing at that site, and that's the only one. Hasselbring and the South Flint Plaza are for vaccinations and boosters. We have both vaccinations and testing at the mini station site in North Flint. So please, you are welcome to give us a call here if you have any questions about that. That number is 810-410-2020. And just one other thing, the City of Flint is continuing to hire. I know I say that every week, it is true. If you could visit us at cityofflint.com/jobs, there are a number of open positions here at the city, including a position as city attorney and assistant attorney here with the City of Flint legal department. So if you know someone, tell someone that those positions are available. Thanks, Yvonne.
Thank you, Kiana. Just want to reemphasize too, the session that was held last night. And for those of you that have not been to one of those sessions, I found it a very open session, and really the opportunity for you to offer recommendations of how you think this $94 million should be spent. If you think there needs to be more money given to some particular area in our community, this is the time for you to put that in. I do understand that there's a limited time for this. Kian, I don't know if you can give us the exact time. The dollars have to be identified where those dollars are going to go by the end of this year and then spent by 2023.
I believe that's 20. It's they're supposed to be spent or the project's designated by 2024 and spent down by 2026. So we don't have a whole lot of time. And now is the time for preparation and planning and making sure that we have all of those things in place early, making sure that we're working efficiently. So again, community, you are invited in to share all of your thoughts about how those dollars should be spent by the City of Flint.
And there's a website that you can go to. And again, just give that, if you couldn't get to one of the events, you can still go on the city's website and offer
sorry to interrupt you.
Go ahead.
You can go ahead and send us an email at input@cityofflint.com. All of that information is being compiled as feedback as well. So there are a number of avenues that we might be able to get the information from the community here to the City of Flint. Visit us at the cityofflint.com's Facebook, or excuse me, City of Flint's Facebook page during the sessions. The comment time, we are there recording all of the questions and comments that you're posting there. If you can attend in person, you are welcome to come over next week on the 8th to IINN and offer your input. Or if you just can't make it and you're not available, then you can send us an email at input@cityofflint.com and share your input on how to spend these dollars.
Thank you, Kiana. Just wanted to make sure we re-emphasize that, because this is the last opportunity openly, but there will still be opportunities in the next few weeks. So thank you. You mentioned also the sites that the city is doing. We wanted to re-emphasize the other sites that are available. Dr. Reynolds, you mentioned that you had an easy time when you went over to one of the sites this week to get your test. And so vaccine clinics are also open. And I was given to understand that there are fewer people attending the vaccine clinics as well. Let's not get too comfortable. My I'm going to say, my brothers and sisters, if you are one that needs to get a vaccine, these sites are available for you this week, coming up Tuesday, Wednesday, Thursday at those normal sites. And there will be a special pop-up clinic on Monday at Kingdom First Church, located at 2452 West Coldwater Road, Kingdom First Church, from 9 a.m. to 4 p.m. They will have all the vaccines there. And of course, you must be 12 years old or older. We're going to be re-emphasizing these community pop-up clinics. There will be a number of them coming up in the next few weeks. And we want to be sure that you understand that access is being made available. Want to appreciate Dr. Hackett and the health department for working diligently to make sure that sites are available. In addition to the vaccine sites, you can go to the testing sites, as Dr. Reynolds mentioned a little bit earlier. You can get your vaccine and you can get tested at the same sites. Word of Life, we repeat these every week. Word of Life, Bethel United Methodist Church in Macedonia. I got a note from somebody just this morning and appreciating this information that we give, because they went over to Macedonia and said it was a wonderful experience for them. They were able to get in, get their testing done, and the staff was so incredibly supportive in that process. If you can't get to any of those sites, remember our other testing sites, which is Walgreens, Hamilton Community Health Network, and Rite Aid, because we want to be sure testing is important. Even in this phase we're in now, testing is so incredibly important. So please follow the protocols, get tested, do it for yourself on a regular basis. And if you need additional support, the health department will always be there at 810-344-4800. Again, that's 810-344-4800. Information is available in both English and Spanish for our use in this community. And so again, we appreciate you so much for making sure you share this information with others. We want to take a few minutes also to let you know that COVID tests are available for people who need them in their homes. We talked about the health department having a hotline to go to homes that need vaccinations and testing, but you can get help from the Greater Flint Health Coalition, who is offering free COVID tests. The number, there's a flyer in the webinar here. For those of you that are not looking and you're on the phone, let me give you a number to call. You can call the Genesee CHAP for a referral. It's 810-953-2427. Call CHAP for a referral at 810-953-2427. They will utilize their platform. They'll make sure that you are able to get a free COVID test for anyone who needs it. There is a limit to 6 per household, but this is another opportunity for us. Dr. Hackett, I want to invite you back. Just quickly before we go to the last segment for the day, if you could help us to understand, Dr. Hackett, even when individuals get their COVID test and they test positive, you do still want them to report this to the health department. Is that correct?
Yes, that is correct. And we have that link on our website. There's a couple different ways to get to it, but if you do a search for SurveyMonkey COVID reporting, it should come up. But otherwise, it is, let me pull it up right now. I'll tell you how to get there. So it's GCHD. I'll look it up here and put it in the chat.
Awesome. Thank you, Dr. Hackett. I just wanted to be sure that our listeners are aware, even when you're testing at home, if you test positive, it's really important that you report that, because that's going to help us keep track of our numbers. In addition, I want you to know that there's another opportunity, drive-through testing at through Biotech. They're out in front of Ashley's Home Store in the parking lot. You can just drive through, but they do ask you to pre-register. We have the information here. You can pre-register at biocovidclinic.com/Flint/. This is another opportunity for us to get tested in our community. And I also want you to know now that you may be receiving a call after you've had your test and you're receiving a negative test, Calls are now being made to individuals who test negative to give them some more education from the HANU sites. If you go to one of the Flint community sites, you may get a phone call even if you've tested negative to ensure that you have all the information that you may need about even how to care for yourself and go to the doctor if you're still feeling ill and it's not COVID. We want to spend, so again, let's use these sites, make sure that we're benefiting from all the opportunities, because when we talk about equity, equity is a matter of access in many cases. We are doing our best as a community to ensure that access is available for everyone who wants to get tested, get vaccinated, get information in any way that's necessary. So thank you for those of you who are social workers and community health workers for joining us every week. We're going to ask Mary Catherine, because we've got a number of questions. We have an increase in the number of individuals who are applying for social work credits. So we want to take a few minutes this afternoon to walk through this process with you, because if you're here, we want to be sure you get what you need in order to get the credits or the contact hours that you need. Mary Catherine, would you walk us through this process?
Yes, absolutely. Okay. I'm really excited about this because like you said, we can get more people, get more needs met. So as soon as you hit that leave button on the end of your Zoom, you're going to have a web page that's automatically going to populate, and it's going to show this image, that the first one that you see up here. When you exit the webinar, and you want to click continue to proceed to that survey. Then it's pretty basic next step. You're going to select whether you're applying for continuing education if you're a community health worker, or select a social worker if you're a social worker seeking a contact hour for your participation. And then you want to follow that survey until it's complete. The next thing is before the end, you must enter your email. And one of the things I really want to point out is that email must match the email that you registered for this webinar with. And that is essential so that we can verify who you are and how you attended and for how long, and which is critical in order for us to give credit. So enter your emails and then hit that blue button to continue, and that'll take you to the very end of the survey. And so the next slide is going to be your proof of participation. So CHWs, or our community health workers, are going to automatically receive a certificate when that survey is completed. The process for social workers is a little bit different. By no later than end of days on Mondays, you should receive an evaluation from the MSU School of Social Work with directions of an evaluation that you're going to complete for them. Make sure to check your junk and spam for this email, as we know sometimes it goes into these folders. You're going to complete that evaluation, and then a certificate is going to generate automatically and go right to your email. Some really just important reminders that I can't stress enough is that you must be in the webinar for your full 60 minutes to get credit. The email addresses, as I said, again, if you really need to be the same so that we can verify your attendance. And you also must be if you can, so sorry, everyone, if you can just reach out, if you do have any questions, if you don't get a survey, if you don't get your certificate, if you have any problems, reach out to us as soon as possible, and on Monday or in the beginning of the week. And you're going to reach out to Atoisha, and I'm going to rely on Nina to get that email in the chat. So you're going to reach out to my colleague Atoisha if you have any problems at all. Her email, I can read it off real quick, is bassenia@msu.edu.
All right. Thank you so much, Mary Catherine. We want you to get those credits. You asked for them. We had a request for them for both the community health workers and the social workers. We want to make sure that we get those to you. And we have other requests. We're going to look into that. I saw that in the chat. We're going to look into if those other, if these apply for other professions as well. Let me say, this is one of the reasons I love the webinar so much, because we've got a right now update. So we're going to back up a few slides to one of our testing sites and give you a right now update. We mentioned, announced that the Kingdom First Church was going to be next Monday. It is actually changed to Monday, April 4th. Kingdom First will be Monday, April 4th. So this is a really important thing. We've got folks in the webinar that are helping us real time, as Dr. Deborah would say to us so often, real time, we're making it happen. So thank you for giving us that update. So mark your calendars for Monday, April 4th. If you know someone that needs to get to that clinic, help them to get there. Today, our time has just gotten away from us. It is time for us to say to you, continue to like us on Facebook at facebook.com/HFRCC. Subscribe to our YouTube channel. You can also email us at info@hfrcc.org, and we thank you for those inquiries. Or you can call us at 810-835-2130. Let me again appreciate each and every one of you that have been here with us. 103 weeks. Next week will be week 104. 2 years we've been talking about coronavirus here in Flint, Genesee County. It's still an important conversation. It isn't limited to coronavirus because there are other impacts that the coronavirus has had on us in this community, along with others. Please join us next week. We're going to give you some highlights from the past and give you a glimpse into the future of the Flint Community Webinar on Coronavirus. Next week, 104 session, 2 years. We're going to honor the commitment that you've made and those who have participated over these 104 weeks. I want to thank you for joining us today for the Flint Community Webinar on Coronavirus, sponsored by the Healthy Flint Research Coordinating Center, and we'll look forward to seeing you next week. Thank you to all of our participants. Have a great week.